from the world's leading center for finance, the arts, publishing, science, research, media, innovation, and much more. This is MetroFocus with Rafael P. Roman.
Tonight, the Affordable Care Act is here. Now what?
We know that they do not know where to go.
Funding for this program is made possible by the Ford Foundation, working with visionaries on the front lines of social change worldwide. Corporate funding for MetroFocus is provided by Mutual of America, your retirement company, and by the following.
Hello, I'm Rafael P. Roman. Welcome to MetroFocus. Whether you call it by its formal name, the Affordable Care Act, or by its nickname, Obamacare, it's here. October 1st marks the beginning of the enrollment period for the new insurance exchanges. It's a massive law with massive implications for individuals, families, businesses, and the economy. In New York, the state will run its own exchange. In New Jersey, the federal government will run it. And it remains to be seen what works and what doesn't. We'll ask two experts with different views about all of that. But first, how will it work in New York? And how does the state plan to get the message out that there's a new way for millions of people to buy health insurance? Rick Carr has the story.
We are a people who like to build new things.
This television ad is the opening salvo in a $40 million campaign to tell New Yorkers about the state's very own health insurance exchange. Although the ad doesn't get around to mentioning that until the very end.
Everyone deserves affordable health insurance. To find out how you or your business can get it, go to New York State of Health, the official health plan marketplace.
Right now, the website is just a source of information about the exchange. But the top item on the state's to-do list is to let more than 2.5 million New Yorkers who need insurance know that starting on October 1st, the site is where to go to buy it.
We know that they do not know where to go right now.
Elizabeth Benjamin is Vice President of Health Initiatives at the Community Service Society of New York, one of 50 organizations statewide that's received a share of $27 million in state subsidies to introduce the exchange to New Yorkers.
We will be all outstationed at various sites, whether they're hospitals, community health centers, small business serving groups like the Chambers of Commerce. We're reaching out to elected official constituent services staff. So there's this real sort of word of mouth kind of effort that's happening.
The state couldn't provide anyone for an on-camera interview, but a worksheet available at its website gives a preview of what the exchange will have to offer. Take the example of a family of 4 living in Brooklyn with an annual income of $50,000. They'll get a new health insurance tax credit estimated at $450 a month and a choice of 9 different health care plans with estimated premiums that range from under $300 a month to more than $800 at the lower silver level of coverage. New Yorkers will be able to get help choosing a plan, Benjamin says, from the same nonprofits that'll be spreading the word.
A lot of people have complicated issues like, I need this drug. Well, then we have to go through all the health plans, formularies, and figure out if your drug, your Lipitor, whatever it is on that insurance plan. Or maybe you want this doctor. There's some decisions to be made.
A lot of low-income New Yorkers will be making those decisions at clinics like this one in Queens. And that means the staff here has to learn a whole new set of skills.
You know, we're doctors and providers. So now all of a sudden we're going to be doctors, providers, and insurance specialists, where we weren't before, but now we really have to be. And that's a big difference.
Sean Granahan is president of the Floating Hospital, so called because for more than 100 years it was based on a boat that sailed to low-income communities along the city's waterfront. Now it's anchored in Long Island City, with a branch nearby in the Queensbridge Public Housing Project. He says it's been a bit of a scramble to prepare for the October 1st debut of the exchange.
I would say 50% of the medical community really thought that we would not be dealing with the Affordable Care Act at all. You know, we thought Republicans would be in, that would be the end of it, and it would be done.
Now 20 insurance companies will offer coverage through the New York exchange. But the expansion of Medicaid eligibility that's coming at the beginning of next year will have just as much of an impact on the Floating Hospital's patients.
I think we'll see more Medicaid patients on the one hand, and yet more Medicaid patients will be falling into the exchange rates. So I think you'll see the same pot of people, they're just going to be reclassified into other areas.
Granahan says Obamacare will still leave a lot of people uninsured.
A lot of them are your undocumented, A lot of them are people who are thrown around in some really dire socioeconomic status that they can't get their act together enough to apply for stuff. I don't really see it impacting, that core group.
Elizabeth Benjamin of the Community Service Society remains a believer, though. After months spent poring over her dog-eared copy of the Affordable Care Act, she says it will lead to more Americans getting health insurance.
I've been spending my entire professional life trying to help people get health coverage. This is the first chance we actually have at making that happen. What's not to like?
Benjamin says even healthy Americans will benefit. As the New York Times reported in mid-July, premiums will fall for New Yorkers who buy their own insurance, at least in the metro area. As Forbes reported 2 days later, in much of the rest of the state and the rest of the country, premiums will rise. For MetroFocus, I'm Rick Carr.
And joining me now is Jim Talon, president of the United Hospital Fund of New York, and Avik Roy, a senior fellow at the Manhattan Institute. Gentlemen, welcome.
Thanks for having us.
Now, Avik, you were in fact the author of that Forbes report that Rick alluded to. So which is it? Will premiums go down or up with the Affordable Care Act?
Well, as Rick mentioned, it depends. It depends on where specifically you live within the state. So New York City will do better, whereas up the Hudson River in the Albany area, they will actually see rates rise. It also depends on other factors like income, and it depends on what market you're involved in today. So the comparison that the New York Times was describing was for someone who buys unsubsidized coverage today in New York versus what the exchanges will offer. New York already had an exchange called Healthy New York, where you could get much less expensive coverage. So for those people, the rates will be about the same or possibly even higher.
But globally, in the long run, up or down?
Globally, across the country, on average, people will see rates increase.
What do you think, Jim?
Beware of averages. The important, at one extreme, as Avik mentions, if I'm in downstate New York, and if I'm trying to purchase directly an individual insurance policy at the current cost compared to what the exchange is going to give me, I'm going to see a lower price. If I am in a state that doesn't have any regulation of its insurance, where if I'm younger, I am offered a product that's a lot less. If I'm sick, I really can't buy that product. If I'm at the other extreme, then what's going to be offered to me is probably going to be more expensive. The most important message is if you're looking for health insurance coverage, go visit the exchange, visit the marketplace, and see how it works for you.
But quickly, Jim, there's going to be subsidies in these exchanges. Who's going to qualify for these subsidies?
Well, it basically is based on income, and it is between 100 and 400% of the poverty level. I mean, essentially, this is going to be up to a family with roughly a $90,000 income, up to an individual with a 40 and
so a lot of people
income. A lot of people, and it's a declining subsidy if you're low income.
Right.
But remember, poor people are going to be eligible for the Medicaid program.
Got it.
That's a separate debate. Some states are going ahead with this. In New York, we have a comprehensive Medicaid program. Other states, there's still a big battle going on.
We've asked our viewers to submit questions for you guys, and we have one from Sam from Buffalo, and he asks, who pays for the reduced rates that are offered to qualified subscribers? Are we all taxed to pay for ACA coverage for low-income people? In other words, are we all paying for the subsidies?
So in New York State, New York has a very unusual situation because of changes to the health insurance market that took place here during the Mario Cuomo administration 20 years ago. As a result of those Affordable Care Act-like regulations in the past, charging everyone the same rate regardless of age, charging people the same rate regardless of health status. A lot of sick and older people signed up for that coverage, but healthy and younger people were priced out. That's why New York has very unusually expensive coverage today, whereas most states have inexpensive coverage today in the individual market. So what the Affordable Care Act does is it converges that, because everyone's required now to buy insurance through the individual mandate, and because of these subsidies, which are taxpayer funded, those two factors will drive younger and healthier people more than before in New York to shop for coverage, and that may bring prices down. New York will still have more expensive coverage than the rest of the country, though.
Now, Jim, New York State is setting up its own exchange. In New Jersey, they're letting the federal government run it. What's the practical difference?
We'll see. It should effectively be the same from the consumer's point of view. I think probably in the states that have taken responsibility like New York, we're seeing a more aggressive effort. There obviously are more people being hired to be navigators, assisters who will help with this. The federal government is taking responsibility for all of the states that haven't chosen to go ahead. Now, this is not a crazy or new thing. Remember, the federal government employs millions of people. It runs a federal employee health benefits plan across the country. So there's some experience here. But this is largely going to be new. There are big battles in the Congress, obviously, on money being spent to support this. In the end, it ought to work relatively similarly. I think probably states like New York are going to be more aggressive out of the gate.
Now, Avik, the two essential goals of the Affordable Care Act is one, to cover all the people who don't have health insurance in this country, millions, and the other is to make health care affordable. When are we going to know if it's been successful?
Well, we'll know pretty soon in terms of the second goal, and as well as the first, how many people will enroll in these exchanges. The Medicaid expansion, probably people will enroll because it's more straightforward. But with the exchanges, that's the question that all observers are trying to figure out. Will people be willing to spend more, but the same, or perhaps less, for this coverage that today they don't feel that they need? We don't know, and we'll know probably after March, because that's when the open enrollment period for the exchanges will end. So by March, we should have a sense of how many people enrolled, and by that, we'll know whether they think that coverage is affordable.
You agree, Jim?
Two answers. One, there's a drumbeat of negative information about Obamacare. It's a threat, it's a train wreck, all those things. Part of that may have the effect of keeping people from coming out and seeing how it works for them. That's why message number one is whatever anybody else says, check it out for you. Secondly, and I think Avik would appreciate this comment, over time, I think in the first year, but into the second and third year, the companies in the exchange competing for your business, I think are going to have a moderating effect. And the most important thing is your health status isn't going to determine your access to the market. Right now, if you're sick, you don't get in many insurance markets. In this case, it is for everyone, whatever your health status is.
All right, gentlemen, thank you so much. That's going to have to be it.
Okay.
Thank you.
Thank you.
Avik, the employer mandate is the part of the law that compels businesses with 50 employees or more, full-time employees or more, to pay for the employees' health care. But the administration postponed that mandate till next year. How is that affecting the Affordable Care Act overall and the exchanges in particular?
Well, what it's going to do is give businesses a little bit more time to restructure their operations so as to optimize for the exchanges. So a lot of businesses are trying to cut their full-time employees below 50 so that they aren't obligated to offer health coverage, and then they can put them on the subsidized exchanges instead, which is often a better deal for those workers. An important point to understand is if an employer pays for your health coverage, that money isn't falling from the sky. That's coming out of your paycheck. So instead of giving you higher wages, that company is giving you a health insurance package. So it's almost better if that employer gives you more money in your pocket and lets you shop for coverage on the exchanges.
Jim?
You know, the American economy has been tough on working wage people now over 10, 20 years. We understand that, limitations on income. There's downward pressure from employers on their employees. They're looking to get labor at a lower cost. The interesting thing to me was when this debate was going on during the summer, a lot of the firms said we're going to create a lot more part-time employment.
Isn't that happening?
As soon as the mandate was delayed for a year, the companies still were talking about creating more part-time employment. So it's economic pressure. The question, what's the cost to have a worker from benefits and wages? We're going to feel downward pressure on wages until the economy starts to behave in a more aggressive and more productive fashion.
You know, the AFL-CIO and a lot of the most important unions in the country who are the biggest supporters of the Affordable Care Act are now very critical of it. They just barely in the last AFL-CIO convention almost passed a resolution to eliminate it. What's happened?
Well, it's a long story, and I could find the same story back in the 1970s when organized labor was really against governmental efforts to expand health insurance coverage because they fundamentally said, that's what we do. That's what it makes people want to join unions. In some cases, the unions are managing multi-billion-dollar welfare funds, and so they have a lot of interest in keeping often the very good programs that they have. Also, further out in this decade, there is a part, it's called the Cadillac tax or whatever provision in the law, where some of these really comprehensive benefit plans that unions have are going to be subject to additional charges and taxes in the law. So I think they're setting up a debate now that will be sort of an interested debate that they'll have out further in the decade.
So, Avik, Jim touched on this, but can you give us your view of how the Affordable Care Act will affect employment and the economy overall?
Well, one of my colleagues at my Forbes blog, The Apothecary, did a comprehensive assessment looking at the literature of what's actually going on with part-time employment versus full-time employment in the Affordable Care Act. And he concluded that the evidence is pretty much incontrovertible at this point, that the employer mandate is driving more employers to move to part-time workers because of this employer mandate. And I personally think that it would be good to get rid of the employer mandate. I think most advocates of the law, most supporters of the law would agree that it doesn't have that much impact on coverage. It's just whether you get it from your employer or whether you get it through the exchange. And actually, it's a better system, most economists agree, for people to shop for coverage on their own instead of being dependent on their employers. Because when you shop for it on your own, you can take it from job to job, you can leave your job for a time and you're still covered. So that's a good thing, and we should encourage that. And if we get rid of the employer mandate, then employers won't face this pressure of moving people to part-time work.
Now, Jim, would you agree that the promise, the original promise, that if you like your insurance, you can keep it, has not been fulfilled by the Affordable Care Act?
I think there are lots of changes that are out there for some people who have insurance. In some cases, it's that they're going to be offered better insurance. In other cases, there are new standards that are being put into the law. In some cases, you may wind up paying more. There are going to be changes, but I think basically it builds on the private insurance system in America. It keeps Medicare for the elderly, it keeps Medicaid for poor people, and it essentially says, can we structure a market in which we have private insurance companies competing for business with a subsidy for lower wage people, but having created the risk pool, the broader risk pool that the insurance companies said was essential for them to get away from avoiding sick people. That's the big change. It builds on our system. In my view, it's really an incremental step. And 5 years ago, it was really a bipartisan agreement. There's polarization now, but 5, 6 years ago, this was really sort of a common ground, as evidenced by the efforts by Governor Romney of Massachusetts.
Now, Jim, most polls indicate that the majority of Americans are still against the Affordable Care Act. The president says that once people begin to experience the benefits of the act, that they will change their minds about it. You agree with the president?
I follow the polls very, very closely, especially one from the Kaiser Family Foundation, with which I've been affiliated over the years. They do it every month. And what actually happens is the negative number, which is about 42, 43, 44%, stays reasonably steady. The gap, the difference between support and opposition, is the supporters are weakening. Around Election Day, the Democrats were fully behind Obama, and they were in support, and so you got the favorable number up into the 40s. Now it's down in the low 30s, but actually the movement is on the favorable side, up or down. The opponents have largely been there. There really is a partisan affiliation between Republicans and Democrats. Republicans against it, Democrats in favor of it. That is an issue going forward. It's why I say the critical issue now in these next months is just to go out and get people to see how it works for them. If all the negative message keeps people from trying it out, then it's going to be a self-fulfilling problem. The issue is, look at it for yourself.
Over.
Yeah, so the law is actually also unpopular with independents, and I think the reason why is to address your earlier question. The law is fairly disruptive to people who have coverage today. Now, some of those disruptions are good. As I mentioned, it's better for people to shop for their own coverage instead of being dependent on their employer to get it. But for the person who has coverage today, whether you're on Medicare, where there's substantial cuts in the law, or whether you're on employer-sponsored coverage, where there are going to be meaningful changes, I think the general attitude of a person who has coverage today is my taxes are going up, my employer-sponsored coverage or my coverage is being disrupted to help someone else. And so we may think that it's good to help those people who don't have coverage today, and those people will certainly benefit, or many of them will. But I think a lot of the people who have coverage today, they're going to see changes that they may not like or they feel skeptical about, and that's why the law is unpopular. So even once the law is implemented, those changes won't necessarily, those dynamics won't necessarily change.
All right, gentlemen, thank you so much.
Thank you.
Thank you.